All right, Jacqueline Adebijo with you once again, but the topic has not changed, talking about Your Health 360. Today on Your Health 360, anyway, not just today, but you do know that on Your Health 360, there is nothing as regards our health that we do not talk about, which is why we delve deep and talk about, those areas where people don't want to talk about it, because even though it's a bodily function, no one wants to talk about urine, right? Pee, ito. Besides, I don't know what the Igbos call it, forgive me, but I do know that someone will call us soon enough and let us know. However, bottom line, today we're talking about your urine and you. You'd be shocked at how much your urine could be a pointer to whether or not you have good health. And today with us in the studio to help us understand, what we should know about urine and how we can get it better, make sure that we have good health through urine, through ensuring that our urinary tract is clean and all of that, is Dr. Victor Atokes. Dr. Victor Atokes is great to have you with us in the studio. You're welcome.
Thank you very much, ma'am.
All right. So, Dr. Victor Atokes with us. Let us quickly go into the questions. Now, Doc, going by the description of what urine is, maybe we should even ask you first how a medical doctor like you would describe urine. Let's start with that.
So we that are in the field, urine is an ultrafiltrate of the blood and all the waste products during. But to a layman out there, what will I say that urine is? Urine is when you carry a filter and you try to filter the blood, what you will come out with, the waste product and the water, that is what you call urine. Because urine is about 90 to 95% of water and about 5% of urea, creatinine, and the electrolytes during.
So is urine the filtering of just liquid things that we take, or even the solid things we take somehow still manage to enter the urine? Urine still filters that?
Exactly. The urine actually is the filter of the blood. And many things are in the blood. The food enters the blood. The drugs you take enters the blood. Even some things that are present, some kind of things that indicates an illness in your body enters into that blood. So all of them are being filtered by the kidney, and the product that you finally have, in addition to the water, the excess water in the body, is what you call urine.
Okay, so we get that from you. Now, going by this description now, on an average, how often should a normal human being urinate in one day?
Various persons have various answers to that question, and it actually depends on the individual in question. It's not actually the number of times that is more important, but the amount at the end of the day. Because you are meant to void about 800 mils to about 2 liters of urine in a day for an average adult. But for a child, you have about, their own is per kg, per mils, per kg, per hour. So those ones we have about between 0.5 to 1 mil. So it's
for children.
For children, yes.
When you're talking children, between what age to what age?
Yes, between the age of the infants, the neonates. Those ones will pass about 1 mil per kg per hour. Those ones within the first 30 days. Then the ones between the age of 1 month to like 2 years will use 0.5 and thereby to up to 5 years.
So a neonate, for instance, that is 3 kg should pass about 3 mils of urine. Since you said
Per kg per hour.
Per kg per hour.
Yes.
So that's what I'm saying. A newborn baby that is about 3 kg
Yes.
in weight
Yes.
would pass about 3 mils of urine per hour.
Exactly. That is what is expected of that child.
Okay, because what I'm trying to determine as someone who is not too good with calculations, and a mother, and thinking about new mothers out there, how long should it take you before you're changing your baby's diaper? How long should it be between a new diaper being fixed on your baby and that diaper becoming heavy, so that you understand if your baby is getting enough water or not? That's just what I was trying to calculate.
I think at most in 3 hours, if the baby doesn't wet, 3 to 4 hours, if the baby doesn't wet the diaper, it should be a thing of concern.
It should be a thing of concern. In 3 to 4 hours, a new diaper within 2 to 3
hours. 2
Hours.
to 3 hours. Between 2 to 4 hours. Let's say 2 to 4 hours.
Okay, 2 to 4 hours. Yes,
that kind of panic.
Okay, yes. A baby's diaper should be changed at least every 2 to 4 hours. So I guess that's what I was just trying to find out. Now, what's the color? What's the normal color of urine? What should it look like? Because as a person, I'm talking about my own urine. I've seen from golden yellow to very yellow, like almost reddish yellow. I've seen that. So what should the normal color of urine be? And then what are all these other colors? What is it telling us?
In the medical language, we call it amber color. The normal one is the amber color. But to you as a layperson, you can call it pale yellow.
Pale yellow.
Pale yellow.
Okay.
Because it's assumed that the urine is not just water. It contains some things. But then, if you live in an environment where you take excess water, the yellow becomes lighter and lighter until it becomes almost
clear.
So the clearness of the urine doesn't mean that. It means that you are actually taking almost like enough or even more than enough water. And when the urine is getting the color is getting more yellowish or even darkish in color, that is a signal to you that you are getting dehydrated. A very good pointer to dehydration.
Apart from dehydration, are there other disease conditions that could cause for urine to become darkish yellow or reddish yellow? Now, I've had people who would tell me that, now from my urine, I didn't know if I get malaria. Okay? And I don't know how scientifically based that assumption is. Can one tell that one has malaria from the color of urine?
This is not like there's a fixed rule to these things. The person that is having malaria, there's this usual loss of appetite, and when you lose appetite, you know that food, there's much water in food, and increase in the temperature of that person is also increasing loss of water from the body. So the urine of the person is getting concentrated with the advent of the malaria. So for so many persons, they will come down with, my urine is very red, doctor. That time you can but it's not diagnosed. There are other symptoms that are more diagnostic for us as clinicians.
Okay, so it's not the urine that you can.
The urine to us, it points more to dehydration than as being a diagnostic template for malaria.
Okay, so apart from malaria, are there other disease conditions? Just quickly, we're not going to go in depth, but are there other disease conditions that could cause for for one to have dark urine, because there might be someone out there who has dark urine and does not really know that this could be pointing to something more serious. They just think that it might be because I'm dehydrated.
I would say this. If your urine is dark, it depends on how dark. Because some dark is actually blood that is inside. And disease conditions like glomerulonephritis can come with that kind of dark. Even trauma, someone hits you on that part on where the kidneys are located, and blood tends to enter into, you will come down with, even when you have an infection with schistosomiasis or any of these worms that have access to this, you discover that you will come down with all these symptoms. So when you come to the hospital, we are going to ask you to give us your urine sample. Let us see how dark is it. And that will be because by the time we'll now say this is what it is, so that somebody will now stay at home and start making self-diagnosis and trying to find solutions to problems that actually would have just been a simple issue of the.
So I get that you don't want to talk about that here, so that you don't give people, that impression that you can go and treat yourself at home, which I agree with. However, if for instance I'm having dark urine, and I've heard you today talk about dehydration as a possible reason why my urine would be dark. How long can I take water for? Like, I'm trying to hydrate myself. At what point, between what time and what time, should I start to see a change in the color of my urine if my issue is actually dehydration?
Let's correct. Not when I say dark, I'm talking about dark in terms of yellow. Let's get that one correct. Because if it is that dark, like the dark you're talking about, it means that there may likely be blood inside the urine. But then, if you take excess water, it tends to dilute. And as such, after taking for like a day or so, and there are no changes, and you continue, just come to the hospital.
Just come to the hospital. What about those people who urinate, and for one reason or the other, I don't know, even for some people, they will tell you that they flushed. But even then, that the toilet bowl, the place where they urinated, still attracted ants. Is it normal?
No. In the olden days, that was used as a way of knowing if someone is having diabetes. But it's not only diabetes. It can be as a result, because what actually came out is the sugar, the glucose that came with the urine. And so the ants were attracted to that sugar that is in the urine. And that can be as a result of problems that affect the glomerulus, the problems that affect the filtration, the filters or the tubules. And as such, if somebody is having an infection, things like pyelonephritis, somebody is having diabetes mellitus, or even conditions that has to do with pregnancy, the person's urine can actually attract ants. But when you come to the hospital, we will take those blood samples and run some tests to know what is actually in the urine that is making ants to be attracted to the urine.
So should urine foam?
That's a beautiful question. I think some persons get scared when they see that their urine is foaming. Now, for a man, for instance, if you are dehydrated, your urine
would foam.
If you force the urine, as in you are trying to urinate very fast, the guys can bear witness, it will foam. But then, like I said, there are disease conditions like diabetes, like when there is protein, well, not diabetes, when there is protein in the urine that is coming out, in situation like glomerulonephritis, for instance, you will discover that the urine will foam. And in such a situation, when you come to the hospital, we'll subject you to some tests to be able to find exactly what is wrong that this urine is forming. But mostly, have you ruled out the fact that some people, when they go to their toilet, they pour omo into the toilet without even knowing, someone have poured, and they urinate into it and it starts forming. You have to make sure that there's no detergent in that water that you're urinating into.
So, but there must be a way that one could tell the difference between the urine where you're losing protein and the one where, like you said, could be any number of factors. You peed too quickly or forcefully, or, you know, whatever it is, something not to concern you much, to the one where you're actually losing something vital through your urine and you should know. Is there a difference in the kind of...
There will be other symptoms.
Like...
There will be other symptoms.
Like, just off the cuff, what else would one see?
Okay, for instance, there will be swelling of the leg, which is known as edema. There will be swelling of the face, I mean. And there will also, when you check the blood pressure of such persons, it can be elevated.
Okay.
Yes.
Okay, so that would be a pointer to the fact that you know, your urine also foaming. There's an issue, a deeper issue that one needs to look for. Before we even go far, I remember that we hadn't talked about the positioning of the kidneys in the body. I think it's important that you describe to us, Dr. Victor, where the kidneys are actually located exactly. Because you talked about trauma, that someone could hit you there and that could cause for your urine to go red. So where exactly are the kidneys?
The kidneys are located more at the back, towards the back side, where you will have the junction between the rib and the spine. That back, the back side.
Where so the ribs in front?
No, the one by the side. When you are going back.
Okay.
When you are going back.
Yes.
That is the location of the kidney. That is why anytime we want to...
Yeah, but I'm saying our ribs from the front here, taking it to the back.
As you are going to the back.
Yes.
At that back part,
yes,
that is where your kidneys are located. So anytime you see us, we say lie down, and we put one of our hands under your back, and we start to hit something that we are trying to find out whether the kidneys are getting enlarged or getting shrunken, just to find out. That is exactly where it is located.
Okay. So, is there any consequence from holding in your urine? You know, sometimes you're pressed, you feel like urinating, your bladder is sending signals to your brain, you need to pee now, but the environment is not exactly sanitary, or in some situations you just feel uncomfortable, you know, wanting to pee in that place. Doing that over a period of time, could it cause consequences for your health?
There will surely be consequences, but you must have done it over and over a period of time. Like some people hold it as a kind of an exercise. It's really, really not cool. For instance, there's one that is very important to me, and that is when you hold urine. That urine, just like you're putting urine in a place, urine that contains microorganisms that's meant to be flushed out is being held in one place. That place becomes like a caution medium for infections. Now, as you are holding the urine that is meant to go out, it also weakens the walls of the bladder, so that a time will come that what is holding the bladder, the muscle becomes weak, and so urine will not start coming down on their own, and you are teaching the urine to be coming down on their own from that time on. That time,
we're talking incontinence.
Yes, incontinence will set in.
Wow.
And there can also be reflux through the ureter up into
the urine could go back,
and that will actually cause will actually result to problems to the kidney up there. And another one is that it could also result in stasis that will result in calculi, where you have kidney stones. Because as they are staying, there are ions inside that can form something like calcium that are inside the urine. They will not start forming stones, and that can go ahead to block the urinary tract, and which will result in you having some injuries along, because when the stones are trying to pass and you are trying to push them forcefully, later on it can bruise the walls of the urethra.
Wow, Dr. Victor. So you're saying holding urine is a no-no, because if you're saying that it can cause stones, do people oh my god. Okay, so I just suddenly started stammering because I'm like, oh my goodness. And many of us just think it's cool to wait, until when you're in a comfortable place, and we're not always in a comfortable place. So is it possible to have stones in the bladder? Does the bladder develop stones, or those stones actually go back to the kidney?
The stones can be in the bladder. The stones can be in the urethra. The stones can enter into the urethra. The urethra is the one that is down. The one that is up above the bladder is the ureters. It can go up. It can even shift up to even the pelvis, which is part of the kidney up there. And anywhere these stones are formed, as they are scratching the wall of,
as they're passing through, yes,
it can cause injury. It can cause blockade, depending on the size of the stone.
So let's not even encourage. Some of us, our kids say, I want to pee. We'll say, hold it. Hold that pee. So you've heard it. Dr. Victor is saying that's not a good thing at all. Now, talking about habit, not drinking enough water over time, we are hearing more and more of kidney failure now. Can this habit of not drinking enough water lead to be also a predisposing factor to kidney failure?
Yes. Because without water, the blood will be very thick.
Say that again?
Without water,
the blood would be very thick.
Yes, what we call viscosity. It increases the viscosity of the blood.
This drinking water?
This drinking, because it's the water that is part, I said it's 90 to 95% of what you are filtering down. So the water must be there. If it's not there, not just the body getting dehydrated, even the cells of the kidneys need that water too. That's why there is reabsorption of most of the water that is being filtered by the glomerulus.
Wow.
So when you as a person refuses to take water, it doesn't just affect the places, also the kidneys are also affected.
No, it doesn't even just, what we're hearing from you now, it doesn't just affect the kidneys, it affects our blood. Actually makes blood thicker.
Yes.
And that's not a good thing, because thick blood leads to clotting. That means we're talking strokes, clots in the lungs, so many life-threatening.
There are so many things that can come out of it, and it's not desirable at all.
At all.
Because water is what brings about the fluidity of the blood.
So many more questions for Dr. Victor Atooks, talking about your urine and you this evening on Your Health 360, only on Invicta 98.9. Let's go on this commercial break, and when we get back, more questions. The lines will be open. Do stay with us. All right, we're back with Dr. Victor Atokoma, better known as Dr. Victor Atooks, in the house, and we're talking your urine and you. Still have a lot of questions, but you're the one that matters the most in all of this. I would like to thank Mubarak Jibril Malam Himma. I see your words of encouragement on our Facebook page. Thank you so much. And then Eto Uwa Fada Jesus, thank you too. We appreciate your words. If you have more questions, you can drop them off there, especially if you're unable to get through. But the lines are now open, and the numbers are 081 40989 and 07087 989. Once again, that's 081 40989 and 070 989. We're taking your calls now. Hello, good evening.
Hello, good evening.
You're welcome, sir. Go ahead.
It's Engineer Muhammad Falalu Bello calling from Kidumarakadu.
Engineer Falalu, you're welcome.
Yeah. Good evening, doctor.
Good evening.
Yeah, sometimes, when some having some pee, you just have some bad odor.
Yeah.
I don't know what are the reasons. Sometimes you have just normal. That's my question number one. And the second question, you just give an explanation over some people used to keep their pee, supposed to do that at the normal time, but they are not doing it. And that time that to reach the time, like very, serious people, serious time, to supposed to do it. Is it having any implication when you are just, to keep your pee at the time you're supposed to do it at normal time? That's an agree. That's my
Okay, thank
question.
you, engineer. Let's take another call. Good evening.
Good evening, Jocelyn and the doctor at the studio.
Oh, thank you very much,
Thank
sir.
you.
But I'm very, very, very grateful with my listeners here in my house for this educative program. What I want to, I'm happy also that the doctor touched on the water because somebody advised me some time ago that I will be taking this 150 cl of this one water very early in the morning before taking anything. And then 75, maybe around 12, then the other 75 again, at least before 6 o'clock.
Mm.
And in fact, I did that for almost 6 months. I didn't even go to hospital at all. I was normal. So I was thinking that the person did not give me a good advice, but from what the doctor is saying in the studio, I think they do something.
All right.
Secondly, sir, why is that our we the parents were also encouraged to give our children minerals and instead of giving them water to go and drink in the school? I think if they are listening to this program, they should know that if they are combining the whole student, they should give them more water and then less minerals. I think if they are listening to this program, because water is very, very essential, just as what the doctor said.
Okay.
And when I was taking my own water, in fact, my urine had no color at all. So I don't know whether I was doing the correct something, doctor.
Yes.
Okay.
All right. Thank you, Comrade Gabriel. Let's take another call. Hello, good evening. Hello? We're connected.
Good evening.
Yes, good evening. You're welcome.
Thank you. My name is Edwin.
Go ahead, please. You're welcome, Edwin.
Yeah, thank you. I said I was one of I have these challenges that have been in my head. Each time I was being admitted in the hospital and being discharged, I said I have the diabetes. So I find it most of the time I urinate up to like 4 liters. I urinate excess, and to the extent my condition now was even more critical. To the extent I lost my sight, my vision was I lost my view up to now. So I don't know what might be the cause. So I want to ask the Dr. Victor. So what is the cause of that problem?
The pain or the loss of vision?
Both the P was much compared to the way it was before.
Yes.
And presently now I still lost my vision.
Okay.
Yes.
Okay. All right. Thank you very much, Mr. Edwin. Hello. Good evening. Right. Let's take this one more call and then we'll come back to you, Dr. Victor. Hello. Good evening. All right. That call got dropped. Hello. Good evening.
Hello, good evening.
Yes, you're welcome, ma'am.
My name is Jesse, calling from Sabo.
Okay, I didn't catch your name.
My name is Jesse, calling from Sabo.
Okay, Jesse, you're welcome. Go ahead, please.
I want to ask doctor. Normally, I used to take warm water in the morning before my breakfast. I normally do water therapy every morning, but for some times now I stopped taking it. So now I started taking cold water instead of warm water, and now I started having some feelings and some pain all over my body.
Okay.
So I don't know the cause of is it the warm water that I stopped taking or the cold water. So I don't know. So I just want to know about it.
All right. Well, thank you very much for your questions. Dr. Victor, let me come back to you before those questions get too much, but I would beg that you answer them quickly so that we can attend to these many calls that are coming in. Engineer Falalu had asked about whether or not it's good to keep your pee until you get to a place where it's convenient for one to pee. And Comrade Gabriel was just saying that, look, he had tried it, water worked for him. And then, of course, these other questions, I'm sure you had them down. Okay, so.
Okay. I would like to say a very big thank you. The participation level is very high. I think people out there are learning, and that is very impressive. It means that we'll have a society one day where preventive medicine will take over curative medicine.
Amen to that. Amen to that.
For the person that asked about, the engineer that asked about keeping off pee, as soon as you can, like I told us about the disadvantages of these things. As early as you can void, just void. Keeping something that has that will have adverse effect on the bladder and on the tract system is really, really not advisable. So as soon as you can, but we are social beings. You cannot go and stand in front of a filling station and start urinating just because it's holding you. That would be a case of urgency, and which is not really, really. The society will not say because we advise on a radio station that you can stand anywhere and no. At least try that. You now have the urge. You should start planning on where to go and void. Then the person that talked about urine, that talked about water therapy, I'm really grateful to the person. The statistics, the provisions presently is that men should take about 3.7 liters of water, while women should take an average of about 2.7 liters. Now, let me explain this in layman language. That is about 5 to 7 pure water sachets in a day.
For men.
For men.
Okay.
Both
for men and women.
It's between
5 to 7. Okay.
Before we were having like 8, like let's just make it on an average, like that is like 8 cups of water, 8 to 12 or 13 cups of water per day. Once you are having this, and with our climatic condition in this part of the world, I think that will do. So when you wake up in the morning, what happens is this. Why you notice that, what you notice, that you discover that you were more healthy, was because the kidney serves as a filter. And once it filters this urine, the urine in the morning is very concentrated, because over the night, more than 8 hours stretch, you were storing the urine. So when you take in water, you kind of like, should I say, like a flush. You flush across. So it has been proven to be therapeutic, to be very, very good for the people that do it. You wake up in the morning, you take water. It's very good.
So what kind of water are we talking about? Warm,
Some
cold?
persons talked about warm water, but just let the water let's just be ordinary water, not one cold chill water you picked up from the fridge. Let it just be ordinary, or just
room
water.
temperature.
Yes, room temperature water. It's okay.
Okay. Are we done with the questions? Because we have so many calls.
There's the one that talked about diabetes and the eyes complication. One of the complications of diabetes is optic neuritis, and so many. It affects the nerves. There are sometimes that will come, you begin to have tingling sensation if you doesn't manage that diabetes very as soon as possible. And the hospitals are there. Go to the hospitals, get your drugs, and start taking them. I am not saying it will reverse the situation, but it will prevent it from further degenerating. Because we are talking about the eyes now, very soon now it will come to the kidneys. Yes. Before you know what's happening now, you now be having what we call diabetic foot ulcers. So you don't want to reach that situation. So go to the hospital, let the doctor that is managing you review you, let them do a test. If they have to put you on insulin, let them put you on insulin so that you can go back to at least a health status that you have many years to live on it. Diabetes is not a death sentence. Then finally, the person they talked about that is having pains. Is that?
Pains? Did we have anyone? After taking one. Okay. You talked about the cold water and warm water.
Like I said, just take water and take enough of it. And it's not the one that you go and because there's water poisoning. When you start taking water, when you know that you're not feeling like taking water, it's just like you're drowning yourself. That one is at the extreme, at the other extreme. But take enough water and don't wait till when you are thirsty before you take water.
Don't wait until you're thirsty
before you take
and
water.
Yet be careful of water poisoning. Dr. Victor, you still have a lot of explaining to do, but let's take calls. Hello, good evening.
Hello?
Yes.
Hello?
We're connected. Please stay away from your radio set. We're connected.
Hello?
Go ahead. Can you hear me?
Yes.
All right, go ahead with your question.
Okay. Please, I'm suffering from diabetes.
Okay. Have you gone to the doctor? Have you gone to see your doctor?
No.
So how do you know that it's diabetes?
It's because somebody...
Oh my goodness.
Okay. Ma,
okay.
Like I would say,
yes.
Diagnosis of diabetes is made in hospitals and is actually made by the clinicians. That is after asking for some tests. Well, if at home you want to know if you are having possible that is you are suspecting that you are having diabetes, look out for things like increased thirst.
Okay.
Increased urination. That is, you go often to urinate.
Okay.
Then you increase appetite. Then generalized body weakness. Then there's somebody in the family that has this diabetes. So just run 440 and go and see the doctor so that they can do this. And these tests, they are not even costly. They're not costly. They make the diagnosis.
So many people wanting to talk to you, Dr. Victor. Let's take some calls. Hello, good evening.
Hello, good evening.
Yes, ma. You're welcome.
Yeah, Comrade Megara on the line.
You're welcome, ma. Go ahead quickly, please.
I've always advised people who suspect that to go to the hospital on time. I went to the hospital on time and I'm still healing. I went to the hospital in 1984. When it was found out, I was admitted and the blood sugar was brought low. And until today, even though it affected my eyes, I don't use one eye now, and one leg I was amputated. But I am still well now to look after myself because I have actually been with the hospital all this while. So I advise a lot of people to actually run to the hospital in the case of diabetes especially, before they have complications with other things. Thank you very much.
And thank you so much, Comrade Megari. Hello, good evening. When you want to call, please just step away from your radio so that we don't waste valuable time. Hello?
Hello?
Yes, go ahead. Hello? I had to take you off. Hello, good evening. Yes.
You're welcome, madam.
You're welcome. Your name?
May I know whether this food we're taking causes excess urination?
What is that?
The food we're
Food.
eat some food.
Your line is not clear, sir.
And he was asking if there are foods that you take that will increase.
Okay, that can increase urine.
Something
okay, so
like
doctor.
tea.
All right, so answer the question.
Coffee.
Okay. Those
soft
kind of
drinks,
things.
Or the soft drinks.
Okay.
Because what they do is to pull water. They pull water to the kidney. And many of them, like we're talking about the electric.
So even if you put milk, it's still going to pull. If you're taking those the coffee with milk, it's still a diuretic. It's going to pull.
Exactly. But then the milk will kind of, reduce.
like,
but then when we're talking, you don't add milk to your cook, and that one is even very bad. I don't know why many persons will just sit down and be taking, like in this part of our culture, people come for occasions and they serve them with Coke and all these soft drinks. It's just like having like 10 cubes of sugar in a cup of water. If they should put 10 cubes of sugar in a cup of water, you won't take. Oh, then why are you taking it just because it's bottled?
Good question. We're running out of time, Doc, and so many calls coming in. Is urine, does it have healing properties? There are some of us who have done what they call urine therapy, especially early morning urine. They say if you drink it, it has healing properties. Do we have healing properties in urine? Let's take 2 calls to add to that question because we have to go. Hello, good evening. Quickly, please.
Please, good evening. Quickly, I don't know if the doctor did not answer the question that says, somebody says his urine has odor. Please.
Okay, urine.
Because I have a patient that has this urine has odor, bad odor.
Bad odor.
You didn't answer, please.
Okay. Okay, I didn't hear that, but thank you for calling.
If there is bad odor, then it's an indication of something is going on.
Okay.
Because normal urine should not be smelling that bad. Just the normal.
Should it even have a smell? Should urine have a smell?
But the environment we are, because of the kind of things that are being filtered.
The kind of food we're eating.
Yes.
Okay.
But not that urine on its own should have a very bad odor to the extent that someone else will even notice
the smell.
But when you go to a place where people have been urinating, you discover that it has a kind of usual smell.
Yes.
But not the one that when someone is voiding, you will even notice that this is very bad.
What about if the person is on medication? Can some medications give?
Exactly. It can actually have, you would actually have that because some medications are being filtered by the kidneys and it should have that. But then when you are having a bad odor from your urine, it may be that there is an ongoing infection, most likely in the bladder. And as such, you need to go and see your doctor because you see that there are other symptoms that are associated with it.
Okay. Okay. So does urine have healing properties?
There have been so many debates on this, but I can tell you for free. Why will you use urine to treat conditions that already we have drugs that have been tested and trusted? Urine contains microorganisms that as it's coming down, and that is what you want to use in your own treat. Some people even drink it. I try to wonder. And they have writing papers on it.
Exactly.
It doesn't really make any sense. That
so for you, it's no.
It's a no. Just avoid urine.
Let's take one more call, Doc. So many calls. Hello, good evening. Good evening.
Good evening.
Yes, sir. Please, you have just 10-15 seconds. What's your question?
Okay, my question is that I have an aged mother that don't want to take water at all. So what I used to do, I used to get like a Mirinda. I join it with water.
You get soft drink and join it with water for your aged mother?
If I didn't give add Mirinda, if I should not take the water at all.
She will not take the water.
So she don't want to take water. Even if she eats, she will not like to take water. So if I want her to take water, I will add the water. I will dilute it with Mirinda before I give her. That's the time she will take it.
Okay, how much of the Mirinda are we talking about? A full bottle of Mirinda?
Whether it is good like that or not.
Is a full bottle or just a few drops, sir?
Just a few drops of Mirinda.
Not a full bottle.
A full bottle?
Like half.
Like half of the bottle. Every time she wants to drink water,
Mama is already taking Mirinda already now.
All right. So, doctor, what do you have to? Somebody is sending a question here that is it possible to urinate during intercourse? So, just quickly, doc, we've run out of time.
Yes,
Combine.
You can urinate during intercourse, but then it's not.
It's not a problem.
Not really much of a problem. It's yes, because where the urine is coming from and where the intercourse is happening is not often. It can happen. Like I said.
But if it does happen, is it normal?
It depends.
Okay. Because
if the sexual intercourse was actually a violent one, where the urine is coming from and where you are entering, they are close relatives. So it could actually.
So it has to be an
and
abnormal.
it also depends on whether the kind of food, whether the recency of you taking drinks that, if the bladder is full as at the time the sexual intercourse is happening, and you're pushing, there should be. But on a normal, there should not be, because there's going to be ejaculations and the rest of them.
So it's not normal. That's what you're saying. It's not normal to have urine coming out during intercourse, except for extraordinary situations like you described.
Yes.
Okay, so talking about the mother who doesn't like drinking ordinary water, is this?
It depends on how aged the woman is, because you see, I've come to realize that we treat patients on individual basis. If a woman that says is not taking anything except they put Mirinda, if you don't put Mirinda, you will not take. So, would you rather lose the whole ship or some passenger on the ship? Though, in as much as I will not encourage anyone to be taking Mirinda almost every day, but if the woman will not take anything, if there is no Mirinda inside, Mama should be taking, but we can be reducing it. Because many of these things they begin to serve as diuretics, and it's not really.
All the advice you've given us, reel them out in 30 seconds, Dr. Victor Atokes. All that you have told us. You've said we should not hold urine. As soon as you feel like voiding, find somewhere decent and go and pee.
Exactly.
Don't hold pee. It's not good for you. There's so many things that could happen from that. What else did you tell us?
To
drink water.
Drink water.
At least like 4 sachets.
No.
4 or 5, did you say?
Between 4 to 6.
Between 4 to
7.
4 to 7.
Yes.
Per day.
Yes, that is about 2.7 to 3.7 liters.
All right, so that's a good thing. Please drink water. Drink water. Water therapy, we've heard it from a doctor. It's good. Drink water first thing in the morning. You don't have to take it from the freezer. As a matter of fact, that's a no-no. Take room temperature, or maybe for some people, warm water would work. But take water. Is very good for us. What else did you teach us today, Dr. Victor?
By all means, when you notice that you're having symptoms that is beyond your understanding, go to the nearest hospital.
Dr. Victor says go to the hospital, and we're sharing that particular advice. Everything we've said here is to create awareness, to open your eyes up to some of those things that you would have just thought was ordinary. Anything, your urine foaming, you don't like the way it's foaming, even though Dr. Victor says that foaming is a natural part of urination, especially for men. But if you are not comfortable with it, please go and see your doctor. Your urine shouldn't smell, especially if you're not on any drugs and you're not taking some very pungent foods like things that contain garlic, onions, and the rest of it. Go and see your doctor. Dr. Victor Atokes would like to thank you so much for being with us today to talk about something that many of us don't like talking about, urine. It's a part of us. Thank you so much, Dr. Victor.
It's an honor to be here.
Urine is a normal function, and we've heard from Dr. Victor how much urine could be a pointer to our health. Your urine and you. I hope we took lessons away. You want more on this? Keep a date with us on Your Health 360 on this same station in Victor 98.9. Come next week, Friday at 7 p.m. At 6:30 before then, we do Your Health Today, a program brought to you by the Kaduna State Ministry of Health. Until next Friday, watch the color, the smell, the texture, everything of your urine. Let's stay healthy, like Dr. Victor said. Looking forward to a day when preventive medicine will take over curative medicine. Have a great weekend.